I will be breaking down this dissection into two parts. First of all, the external anatomy of the heart, and secondly, the internal anatomy of the heart. Let's take a look at the external anatomy of the heart first, and I like this one because it has the pericardial sac. Now this seems really gross and disturbing to people and everything, but in fact we use the deer heart because it's so similar to what the human has itself. It's not unusual to have, in fact it's very normal to have a lot of fat in the pericardial sac. Now the heart itself is just like most organs in that it is protected by a protective sac, and actually this sac has two layers to it. This outer sac is called the pericardium. The inner liner of that sits on the heart itself, and that is called the myocardium. Myo meaning muscle, cardium meaning heart, so it's the heart muscle layer, and the peri means around, so it's a pericardial sac. It sits around the heart, and it's important for anatomy students to kind of tie some tissues and other things that we've studied to this point. This is an endothelial type of tissue. The purpose behind these is to slide smoothly past one another. What I'm going to do is I'm going to cut through this pericardial sac. It's a very, very rigid and tough membrane, very difficult to tear. And I've rinsed these out as best as I could, so you shouldn't expect to see a whole lot of blood. If we do have some, it's just coagulated blood, and I'll quickly get that out of the way. And I want to be careful as I'm doing this because I don't want to cut through any blood vessels that lead either into or out from the heart itself. We'll be taking a look at those in this dissection. A little bit of a thymus gland that's still on the heart. And actually a little bit of trachea. Good job in harvesting this and saving everything. The trachea obviously is going to be leading to the lungs. That's going to be closely tied to the membrane itself. In fact, it's held together by ligamentum arteriosum, something that holds all these tubes together so they don't get twisted up. Okay. Now some basic orientation. We're going to be taking a look at, like I said, we're going to be looking at external structures of the heart. Now it's important to keep in mind, first of all, our orientation right and left. We'll explain all these tubes and everything up above at a later time when we investigate the internal anatomy of the heart. But all I want to do is point out some external anatomy. First of all, we've got the base of the heart, which is actually up here. People always mix this up. The base of the heart is the widest part, and the tip is called the apex. Now, we need to figure out our right from our left. You'll notice that all the tube work kind of runs away from the front here. If I were to flip the heart over this way, we would see that it would go toward us, or toward the front of the heart. Okay, this is the back of the heart, the dorsal part of the heart. This is the ventral part. Now you'll notice that we have one big chamber that runs here and around the apex. This is the left ventricle region. In fact, the heart was damaged at this point, right at that point, that separation point between right and left ventricle. Now, we'll see that it wraps around to this point. So the right part of the heart, this heart is not perfectly symmetrical like you'd see on Valentine's Day, but in fact, you'll find that the right side of the heart is actually up higher and off to the side, and the left part actually dominates the front, or the ventral part of the heart itself. What we see are the two large chambers called the ventricles. There is a little divider line in between these two, and it's separated. You can see some coronary arteries and coronary veins. There's actually a divider between these two. This is called an interventricular septum. A septum is a divider, inter means between, ventricular means ventricles. So an interventricular septum is just a fancy way of saying a divider between the two ventricles. Now, up on top, we'll see they look almost like two ear flaps. These ear flaps are called auricles. Now, these auricles on the inside are chambers called atria. So there's a separation between the atria and the ventricles. These are the atrioventricular grooves, grooves between the atrium and the ventricles. Let's see some other structures that we'll find here. We find the large aorta coming off, a pulmonary trunk, and we'll investigate these more. Basically, when we say trunk, we mean where things will come together to form one larger structure. We have ligamentum arteriosum that holds, it's a tough type of connective tissue that holds these openings together. We'll investigate that more when we take a look at internal anatomy. We also have structures like the brachiocephalic artery. We see the aorta here and the brachiocephalic here. Now, if you remember with the cat heart, we had one brachiocephalic and a left subclavian coming off of that. The deer heart is set up a little bit differently, where we've got the aorta, we're going to have brachiocephalics, and then they will branch to the subclavians. So we'll address some of those differences at a later time. As far as external anatomy goes, we've got the base, we've got the apex, we've got the right ventricle here, we've got the left ventricle here. We've got auricles, which are the ear flap-like structures here and here. And these will, on the inside, are chambers for the atria. Now blood will enter through the atria and work their way in and down into the ventricle, out of the right ventricle to the lungs, back to from the lungs to the left atrium, down to the left ventricle, and out through the left ventricle to the body. And we'll take a look at those more in detail when we take a look at internal anatomy.